Hey guys, Dr. Andy here. Today we are going to show you how we assess plantar fasciitis in my office, okay? So as I said in our last video, we are seeing a ton of plantar fasciitis type conditions and pain in our office, especially amongst our runners, okay? So if you're a runner and you are suspecting that you have plantar fasciitis, if you're a new patient in our office, we're going to do an eval on that. We are going to assess to make sure that it is plantar fasciitis because that's going to dictate our treatment. Obviously, if it's not plantar fasciitis, we don't want to travel down that hole and try and treat, the bottom of your foot when we should be up there in your knee or maybe your hip, because the pain can be coming from up there and causing some pain and some radiating symptoms down here. So we want to make sure that if you're coming in with foot pain, you're a runner, and you are suspecting plantar fasciitis, we want to make sure that we're giving you the right treatment. So we are going to make sure that we do a really good assessment, okay? So that assessment starts with a really good history, all right? So what that means is I'm going to ask you lots of questions about your pain, okay? This is probably the most important part of our assessment of our eval to make sure that we get a good diagnosis because there are two really common things that happen with plantar fasciitis that we want to make sure that's kind of like hallmark for the case. And so if these two things kind of come out of the history, then we know this is at least something that we should be evaling for, okay? The first and most obvious is, where is the pain, okay? Plantar fasciitis pain is going to be right here in the center of the bottom of the foot, or maybe even a little bit closer towards the heel, okay? It's not going to be up here, where your Achilles is. It's not going to be up on top or anything like that. Your plantar fascia runs along the bottom of the foot from the heel to the balls of the feet. And so we're going to be central right in the very bottom of your foot, or even maybe a little bit closer towards the heel, okay? And the pain is going to be sharp. It can be stabbing sometimes. And the second and other big part of kind of the history of this to make sure that it's plantar fasciitis is that it's typically, almost always, very, very severe, or it's absolutely going to be worse first thing in the morning, okay? And here's the reason for that. As you're sleeping, that plantar fascia gets kind of tight, it curls in like that, and then you take your big first step for the day, you go weight bearing, it stretches the fascia, and if there's any inflammation in that from plantar fasciitis, that causes your big jump in severity and makes sure, and it's going to result in the pain being a lot more severe, okay? So if the pain is right down here at the bottom of the foot, and then typically first thing in the morning when you first get up, those are two clinical indications that we're talking about plantar fasciitis, okay? Now also, if you watched our last video, you're going to know that a big part of the plantar fascia being out of whack is going to be because of the calf muscles. So your gastrocnemius muscle and your soleus muscle, if these guys are tight, it's gonna cause a problem all the way down into the bottom of your foot, okay? So in our office, we're gonna check your calf muscles. We're gonna go in here, we're gonna start pushing around. Very, very commonly, we're going to find some big, huge knots in there, right? So muscle spasms. The muscle's not going to be soft. It's not gonna feel squishy like this cushion or this table right here. It's gonna feel much harder, okay? That's how we know that we have some muscle spasms in the calf, okay? It's probably going to be a little bit sore. It's probably going to be a little bit achy as I push through there, okay? So step one, we're going to look at the history of the problem. Step two, we're going to start to evaluate the muscles. And then step three, we are going to evaluate the joint mechanics, okay? So Connor, do me a favor and flip on over for me, buddy. Good. We're gonna look at one big one and then a couple other small ones, okay? So I'm gonna be looking right here at this ankle joint, okay? We should have pretty good range of motion through the ankle, all right? So first thing I'm gonna look at is how far can I push his toes, or the patient's toes, towards the rest of his body, okay? He gets to about 90 degrees, all right? That's very restricted. That's not nearly as good as it is supposed to be, all right? He should be able to get a little bit farther, maybe about that angle right there. So that tells me two things. One, that the actual calf muscles are too tight, meaning as that we try and stretch them. The calf muscles that are spasmed are preventing him from going any farther. It also tells me that the ankle joint itself is probably a little bit locked up. I get in there and we start to look around. Yeah, he has loss of range of motion. Basically, we know that the ankle should be able to move a certain range forward, backward, side to side, and a little bit of a twist inside and out. And as we move through that range, It's absolutely locked up. It's not moving very well. As a result of the ankle joint basically malfunctioning and what we call a joint blockage, it causes a lot of stress into the muscles here and into that fascia, and that's how we can kind of get that pain along the bottom of the foot, that plantar fasciitis, okay? We'll also look at the joints of the foot itself, right? We call these the talar joints and the metatarsals. So we're gonna look at these, we're gonna see how they're moving, right? They're not moving too bad, but again, if there's any kind of joint blockage or joint restriction through these joints, right, then we know it's also going to cause some stress into the plantar fascia. It's going to change the way that we walk, and anytime we change the way that we walk, it causes extra stress, extra tension on the muscles and down and through the fascia, okay? We don't want extra stress. We don't want any extra tension that's not designed to be there, right? Because that will cause over time a repetitive stress injury, which is exactly what plantar fasciitis is, okay? So 3 things that we're really gonna be looking for in our eval for our plantar fasciitis. That is your history, muscle tension, especially through the calf, and then we're gonna eval the joint function, ankle, foot. I can pretty much guarantee you that I'm going to look at your knee and hip as well, because if your knee and hip isn't working very well, again, same thing, it's causing some stress down and through here, okay? Those are the 3 steps of the eval for plantar fasciitis. I hope you learned something. If it's bothering you, let us know. We'll basically be doing the exact same kind of eval on you, all right? So if you have any questions, let me know, and always remember to live with passion, not pain.